for OA. It's a mechanical problem if you're talking about pure OA. So I'm sorry, weight reduction does work, but the diet by itself is not going to work. Yes.
Is your office address and everything over there somewhere?
Yes.
How do you distinguish osteoarthritis from any other type of arthritis with almost the same symptoms?
Well, again, you're talking about combination of different things, right? You're talking about, first of all, when we look at the joint under ultrasound, we can see immediately zillion different things. We can see whether the joint is inflamed or not. We can see whether you have erosions or not. Or we can basically check and see how your cartilage looks like, right? We can look at your tendons, ligaments, and so on and so on. So if you have crystals, we can see them on ultrasound right away. So then we do blood work, obviously. So if you have any markers of inflammation, we're trying to find why you have inflammation. So by sorting out other things, so you can eventually nail down.
Everything down to that.
Yep.
Okay.
Right.
Is there some kind of accreditation, whatever that word is, accreditation for Pilates instructors?
Yes, absolutely. So, like our physical therapist, she's a doctor of physical therapy, but she's also certified Pilates therapist. So yes, absolutely, there is a certification. Actually, one of the Southern California accreditation facilities is in Escondido. So the Center for Pilates Certification, yes, absolutely.
Is that the same thing for laser, that they need a special certification?
No, for laser, any physical therapist and any physician can use laser after appropriate treatment. So when you purchase the equipment, the company treats, they basically treat so many patients with you, right? And then they provide you with a certificate. So, but the state doesn't require any special certification for laser.
Are you familiar with arnica or arnicare?
Arnica is a homeopathic basically product which is used for mild pain. So you can use it. Some patients do benefit, some patients don't. So, anything else?
Another question.
Yes.
If you want to use like fish oil, like
Yes.
oil, like you were saying earlier,
Yes.
do you have to worry about if you take it in high doses that it will affect, like your liver or something like that? Or?
Well, it's a good question. So if you take high dose of fish oil, krill oil, what to expect, right?
Yeah.
So basically there are certain things which you will expect. So if you take the high dose, so you start having a little bit of aspirin-like effect. So you start having little bruises in your skin, right? You start having some problem with bleeding. So, but in terms of liver, typically doesn't happen. So if you have some problem with pancreas, if your body doesn't make enough enzymes, you may end up with bloating, right? That's what we see in our practice, but nothing else.
Okay.
And again, it depends what kind of fish oil you're using. Like in our clinic, we're using almost exclusively fish oil, which is basically highly concentrated. So, and it's called distilled fish oil. So it's guaranteed that it has no any heavy metals, no pesticides, so it's just highly concentrated. So it's almost like a drug, basically. And you know that there are some brands which are available by prescription only, right?
No, I didn't know.
Yes, yes.
You prefer the krill oil over the fish oil and the green?
Personally, yes. So because the difference between krill oil and fish oil is based on the lipids, right? So most of the lipids within the krill oil, the so-called phospholipids, they're much more bioavailable, so they're highly absorbable, they have higher biological value than EPA and DHA from the fish oil. And it's been shown it's a 2-to-1 ratio, so for each gram of krill oil, you need to use 2 grams of fish oil to reach the same effects. Yes.
I had a lot of indigestion though when I took fish oil. Is that the same thing for krill? I mean, the same thing?
It's pretty much, I would say yes. So most likely you don't digest fat well, and so you need to use digestive enzymes. So if you take fish oil with digestive enzymes, it will help you to eliminate all the problems with bloating. Yes.
I take meloxicam on a daily basis.
Yes.
Is that what you were talking about, NSAIDs?
Yes, if you take meloxicam on a daily basis, you put yourself at certain risk of having stomach ulcer, gastric ulcer, right? And risk of having hypertension and kidney damage. Yes.
So you can't take that forever.
Well, you know, the cutoff typically, if you look at traditional literature, is 5 years, so you don't want to take it beyond 5 years. So because then your risk goes up very rapidly, right? for 5 years it's okay, but personally in my practice, I'm trying to keep my patients on NSAID for no longer than a year, maybe max.
Wow.
There are better options, let's put it this way.
Okay, thank you.
Right. Thanks.
Thank you again to Dr. Strickland and the Institute of Specialized Medicine for bringing this to us today, along with Caring Pharmaceuticals. Like I mentioned at the beginning, we have a lot of literature over here available to take home. So some of the brochures that are provided by the Arthritis Foundation, some of the brochures that we have, Arthritis Today magazine, information on our Walk to Cure Arthritis, so hopefully we'll see a lot of you coming and joining us. And we do have